The world watches with bated breath as news of a new virus begins to spread across the globe. A new virus is spreading and its reach is expanding rapidly. This time the epicenter is China, where hospitals are seeing a surge in cases overwhelming the healthcare system. The culprit? Human metapneumovirus, or HMPV, a virus that has caught the world off guard. While not entirely new to the medical community, this respiratory virus is raising global alarm bells due to its rapid transmission. Its rapid spread and potential for severe complications, especially in vulnerable populations, have put health authorities on high alert, scrambling to respond. Could this be the next global pandemic? The question looms large in everyone's mind. Understanding HMPV is crucial to answering that question, as scientists and researchers race against time. The situation in China is a stark reminder of the interconnectedness of our world, where a virus can travel across continents in mere hours. What begins in one corner of the globe can quickly escalate into a global health crisis, affecting millions. The specter of the COVID-19 pandemic looms large, serving as a stark reminder of the devastating impact a novel virus can have on society. The world is watching, waiting, and hoping that this time we are better prepared to face the challenge. We must learn from the past and act decisively to prevent history from repeating itself, ensuring a safer future for all. HMPV is a single-stranded RNA virus, which means it carries its genetic information in a single strand of RNA. It belongs to the Pneumoviridae family, a group of viruses known to cause respiratory infections in humans and animals. First identified in the Netherlands in 2001, HMPV is now recognized as a common cause of respiratory illness worldwide, affecting people of all ages. Its symptoms often mimic those of the common cold or flu, making it difficult to diagnose without proper testing and medical evaluation. Patients often experience a runny nose, cough, sore throat, and fever, which can be mistaken for other respiratory illnesses.
While most people experience mild illness, HMPV can be dangerous for certain individuals, especially those with pre-existing health conditions. Infants, the elderly, and those with weakened immune systems are particularly susceptible to severe complications which can lead to more serious health issues. Bronchiolitis, an inflammation of the small airways in the lungs, and pneumonia, an infection of the lungs, are serious concerns associated with HMPV. These conditions can lead to hospitalization and, in rare cases, even death, highlighting the importance of early detection and treatment. Understanding who is most at risk is crucial for effective public health interventions and to prevent the spread of the virus.
China is facing a surge in HMPV cases, particularly in its northern provinces. This virus, known as human metapneumovirus, is causing significant concern among health officials and the general public alike. Hospitals are overwhelmed with patients and healthcare systems are strained. The influx of cases is putting immense pressure on medical staff, who are working tirelessly to manage the situation. The situation is eerily reminiscent of the early days of the COVID-19 pandemic when the virus first emerged in Wuhan. The memories of lockdowns and widespread fear are still fresh in the minds of many. The world is watching closely, drawing comparisons and trying to gauge the potential for a global outbreak. Experts are analyzing data and trends to understand the virus's behavior and transmission patterns.
While the situation in China is concerning, it is important to note that the World Health Organization has not yet declared a global health emergency. They are, however, monitoring the situation very closely. The Chinese government has implemented strict monitoring and preparedness measures, drawing upon lessons learned from the COVID-19 pandemic. These measures include extensive testing, contact tracing, and quarantine protocols. The international community is also on alert, sharing information and coordinating efforts to prevent the spread of the virus. Collaboration between countries is crucial in these times to ensure a unified response. The hope is that by acting swiftly and decisively, we can contain HMPV and prevent a global crisis. Scientists and healthcare professionals are working around the clock to develop effective treatments and vaccines.
Public health measures, such as social distancing, mask wearing, and potential travel restrictions, may be necessary to slow the spread of the virus, especially if it becomes more widespread. These measures, while disruptive, have been proven effective in containing previous outbreaks. Ensuring medical surge capacity is crucial. Hospitals need to be prepared to handle a potential influx of patients, and healthcare workers need to be adequately trained and equipped to treat those infected with HMPV. Cover your coughs and sneezes with a tissue or your elbow. This simple act can help prevent the spread of respiratory droplets that may contain the virus. Avoid close contact with people who are sick. If you are feeling unwell, stay home to prevent spreading the virus to others. Wearing a mask in crowded places, especially during outbreaks, can also help reduce your risk of infection. We must also combat misinformation and promote accurate, evidence-based information about HMPV and other infectious diseases. This includes educating the public about prevention measures, such as hand washing, masking, and vaccination when available. The fight against HMPV is a collective one. It requires global cooperation, scientific innovation, and individual responsibility. By working together, we can mitigate the impact of this emerging virus and build a healthier, more resilient world.